There are dozens of medical conditions and other causes for tinnitus. Some of them can actually be serious conditions that you really want to take care of as soon as possible. But it's important to remember that tinnitus itself is just a symptom of something else. Therefore, the only way for you to get immediate relief while ruling out serious conditions is to know two things. One is your tinnitus type, and two is what caused it. Hi, my name is Guy, and I've been suffering from severe tinnitus for over a decade now. In this video, I will explain to you the different tinnitus types, the causes for them, and of course, how to get relief as quickly as possible. There are 4 types of tinnitus. The first one is subjective tinnitus. This is the most common type of tinnitus, and it just means that you're the only one that is hearing the tinnitus sounds. The second type of tinnitus is objective tinnitus. This one actually can be observed or heard by a medical doctor or a neurologist which are examining you. The next type of tinnitus is pulsatile tinnitus. And this is the one where the tinnitus that you hear resemble your heartbeat. The last one is a neurological tinnitus. And this one has to do with disorders of the nervous system that affect the auditory system. So something like the Meniere disease, or anything that can cause dysfunction in the way that the brain processes sounds. When we talk about subjective tinnitus, there are 4 subtypes of subjective tinnitus. The first one is the high-frequency tinnitus, which only means that the sounds that you hear are typically high-frequency sounds. And then there's the low-frequency variation, which obviously means that you are hearing low-frequency sounds. There's what's called musical tinnitus or musical hallucination, and that's it's a separate condition that typically experienced by older people, and it has to do with the way that the brain processes sounds. So it's an auditory system issue, and I will try to address it as a special case later. And then finally we have somatic tinnitus. Somatic tinnitus is a subtype of subjective tinnitus, and it results from tension around your head, neck area, cervical spine. If you have tension, if you suffer from TMJ, if you if you have a head injury or back injury, that can cause tinnitus as well, the somatic kind. The one really easy way to find out if you have somatic tinnitus is to have yourself or someone else massage the area where you have pain. So for example, if I'm going to massage my neck or my shoulder area, or maybe even my head, and I notice a change in tinnitus, whether it's how loud it is or what kind of sounds I'm hearing, that is a good sign that you may have somatic tinnitus. These are the 4 types of tinnitus and the 4 subtypes of subjective tinnitus. Okay, so now we're going to start talking about the causes for tinnitus. And remember, we are doing this because we want to understand how we can get relief as soon as possible. The main causes are actually hearing loss, which is the most common reason to get tinnitus. I don't know the exact percentage, but it's very high percentage of people that have tinnitus also suffer from some level of hearing loss. The second thing is ear or sinus infection. And then there's diseases. There are some kind of heart diseases or the Meniere disease that can cause tinnitus. And then, to complicate things even more, we have medication. There's some medication that you can take to deal with something completely different that can cause tinnitus. Then we have acoustic neuroma. Acoustic neuroma can cause tinnitus. And then we have this dysfunction of the eustachian tubes inside your ear that can cause tinnitus. So you can see that there are many different causes for subjective tinnitus and somatic tinnitus. Now let's go over the causes for objective tinnitus. Objective tinnitus can be caused by vascular disorder, by muscles in your ear that are spasming, by TMJ, and even a tube issue where the tube stays open most of the time. Okay, so the causes for pulsatile tinnitus. Most of the times, the causes for pulsatile tinnitus are vascular issues in the blood vessels around this area. What I want to say before we get into treatment is that if you are not sure what is your tinnitus type, and if you don't know what caused it in your case, my recommendation is that you go get checked out by ENT, doctor, or whatever in your country, whatever is the name of the specialty, and then go get checked by an audiologist, assess your hearing, assess your medical condition that can affect tinnitus, and only then proceed forward. Okay, so we are jumping into treatments of subjective tinnitus. And the first treatment type that can get you relief pretty fast is sound therapy. Now, sound therapy fall into different categories. Let's start with the most known, I think, sound therapy, which is white noise and pink noise and brown noise. These are just different sound therapies that are targeting different frequencies. Remember that when I was talking about subjective tinnitus, I explained that there's the high frequency tinnitus, there's the low frequency tinnitus. Well, when you're choosing a sound therapy, you want to choose a sound therapy that will be effective for your for your tinnitus, for the kind of sound that you hear. So if your range of frequencies that you hear as a tinnitus is mixed, it's low frequencies and high frequencies, you want to use something like white noise sound therapy, because that's a full sound, it's a full range of frequencies. If your tinnitus happen to be low frequency, you may want to use the brown noise. I'm pretty sure the bright noise is the lower frequency. And there's also a pink noise. I'm actually going to create a separate video that just explains sound therapies, because it's so not complex, but it does so much to consider. So I will explain that in more details. The next kind of sound therapies is actually sound therapies that mix the masking sound that is specifically targeting your tinnitus. Like, you can mix those sound therapies with music, with relaxing musics. And then the combination of relaxing music and the sound therapy, which is targeting the kind of frequency that you hear, is double duty in relaxing you, which is so important for the fight against tinnitus, and also masking the sound, trying to get your brain to focus away from the tinnitus sound. So by using both, you are achieving two things at the same time. Now, the one thing that I didn't mention about the white noise and brown noise and pink noise is that those specific noise therapies, all they are doing, they are trying to mask the tinnitus sound away from your brain. So your brain is saying, oh, wait, I have this other sound, I need to focus on what is that? And by doing that, you're steering your brain away from the tinnitus. And then when you stop the sound therapy, your brain doesn't notice the tinnitus as much as before. Okay, the next the next treatment type for subjective tinnitus is what's called CBT, which is cognitive behavioral therapy. This therapy is typically lasting months, weeks, or months, and the goal of this therapy is to perceive the tinnitus as not as negative as before. So right now, what happens to most of us with tinnitus is that it bothers us, right? We think about it all the time. It interrupts our focus. It just becomes this negative thing that we focus on, and it can really start affecting you emotionally and physically. The more you focus on it and the more you notice it. So CBT, what it does, it's trying to really change the way that you perceive tinnitus. It's trying to remove the negative emotions and remove the negative thoughts and just kind of ignore it, just kind of let it go. And then the more that you do that, the less impactful tinnitus is on you. So that's CBT. Now we are moving to TRT, which is tinnitus retraining therapy. And this is a different kind of therapy that typically lasts much longer. I have not gone through TRT myself, so I cannot attest to it from personal experience. But from what I know and from the research I've done, it's a longer lasting therapy from many months to maybe a year or two, and the goal of this therapy is really to habituate tinnitus to the point that your brain is just not hearing it. It's just like it's not there. Okay, so the next treatment type for subjective tinnitus is hearing aids. Yes, you probably need to see, I don't know if you can see my hearing aids because they're kind of deep inside, but hearing aids are very useful on a few different levels. First of all, tinnitus is there because the brain is trying to listen too hard to the sound that it's missing, right? As if I have hearing loss, or if I have hearing damage, like if I was exposed to really loud sounds which created damage in the hair cell in my ear, and now I'm missing some sounds, my brain is trying to listen too hard, overdrive, to find those missing sounds. And by doing that, it creates a tinnitus. Well, while I'm hearing hearing aids, I'm hearing everything around me in a much more natural way, and I'm hearing much more of the sounds that I would not hear without my hearing aids. In fact, well, in my case, without my hearing aids, I'm half deaf basically. But even if your hearing loss is not as severe as mine, you are missing sounds, and by using hearing aids, now you get those sounds back, which makes your brain kind of relax. I'm not sure if this is the right term, but basically now you're hearing those same sounds that the brain is trying to hear. And by doing that, you're alleviating tinnitus. There's a survey of people that are using hearing aids, and big percentage of them are saying that while using hearing aids, they perceive tinnitus way lower than without hearing aids. So that is the point over there. The second thing is many hearing aids these days are coming with masking programs built into them. So like right now, I could be running a tinnitus program in my hearing aids, which is either giving me sounds, like those kind of white noise and brown noise and all those things that we were talking about before, or I can just simply listen to music. I can listen to sound therapy as I'm reading email or as I'm doing different things. I can use the hearing aids as earbuds and just listen to sound therapy while I'm doing different things. So that is the other aspect of it. So hearing aids, if indeed you have hearing loss, hearing aids is a big part of treating your tinnitus. Okay, so the last type of treatment I'm going to be covering for subjective tinnitus is the bimodal neuromodulation devices. And this became, I think, much more known with the linear. Linear is a device that is stimulating your tone while you listen to sound therapy. So you're listening to sound therapy and stimulating the tone at the same time. And this bimodal neuromodulation is being proven to really help the brain, again, focus away from tinnitus to the point that tinnitus is much less noticeable or much less bothersome. It's been now a few years that this device has been out there and real patients are using it, and there are different surveys and different results that you can find online, and I actually covered in some videos myself. I think it's to the point where it's definitely proven to be effective to some people. Not everybody is affected the same. Remember, this is the whole thing about tinnitus. What works for me may not work for you. So some people are saying that this kind of stimulation is not working for them, while other people saying it's working for them. And that could be part of what tinnitus type they have and what other conditions they have. And now the next part is that there are now more and more research teams across the US and I think across the world that are coming up with similar research. There's a University of, I think, Michigan that is going to come out with a similar device, but instead of stimulating your tone, it's going to stimulate your neck, or they're going to put electrodes next to your ears, or I think around your neck, or maybe they can move them between different locations, and of course at the same time have sound therapy. But again, it's the same again, bimodal neuromodulation model basically. And there are other devices like that I think are going to get released here as soon as they go through enough testing and regulations, and they will become available as well. Okay, so now we've gone through 4 or 5 different treatment types for subjective tinnitus, and you may ask me, okay guys, so you gave me 4 or 5 different options, which one should I go with? Well, my question back to you will be, do you know what your tinnitus type is and do you know what caused it? If you do, it's easier to choose the right type of treatment. Also, and again, if you don't, I really recommend that you go work with a physician or with an audiologist to answer that question, because this is, in my opinion, very important. And then the second part is that some of those treatment options are more expensive than others, and I cannot, obviously, I don't know your financial situation or what you can afford or not. Like, for example, the bimodal neuromodulation devices tend to be more expensive. They are not covered by insurance, as far as I know, at least most insurances. So you need to have the financial means to even consider that kind of a treatment. So I think it's a combination of knowing what you really have, and then knowing what you can do, and then going with the right option for you. If it's up to me, I would really recommend that you try sound therapy. Remember, there are many different types of sound therapy. There is the pure tinnitus sound therapy, which is targeting the frequencies of tinnitus that you have, but there's also the combination of music and sound therapy. So you can try both, and you can try different frequencies and see what happens. I would try that for at least a few weeks before I go to try a different therapy. That's just my opinion. If you tried it already and it's not working for you, maybe it's time to move to the next step. And maybe the next step for you is CBT. That's how I would go about choosing what to do when, basically. Okay, so now we are moving to somatic tinnitus treatment options. And remember that because somatic tinnitus is a result of a physical tension or injury or problem around your neck and your back, it's and I'm saying it's relatively simple to either yourself or have someone else massage the muscles that are you feel pain with or you feel tension with. You can use a massage therapy. You can use a chiropractor. You can use different options to physically try to address the tension and the pain that you have. And if you do have somatic tinnitus, that should result with pretty immediate relief right there. The second thing, it turns out that the bimodal neuromodulation devices that I was just talking about for subjective tinnitus are also effective for somatic tinnitus. Okay, then the next type of tinnitus that we're going to talk about, actually I'm going to combine two into one. The objective tinnitus and pulsatile tinnitus, they have similar aspect in that they result with physical condition around this area. So it could be muscles which are spasming, there could be high blood pressure, it could be some problems with the blood vessels that are going inside your head, around your ear and the brain. So I think what you have to do with both is first diagnose what's going on. And then the second thing is you will start addressing those issues. So for example, I'm just giving a simple example, guys. If I have high blood pressure and the high blood pressure causing a pulsing sound in my veins over here, which results with pulsatile tinnitus, obviously I need to treat the high blood pressure for other reasons as well, but that will result with improvement for my tinnitus. If I have some muscular issues that are causing objective tinnitus, that the audiologist or ENT can actually observe as well, I need to deal with those issues first, and that should result with improvement or even elimination of my tinnitus. So when it comes to objective tinnitus and pulsatile tinnitus, this is your treatment plan. Is first diagnose exactly what's going on by going to a physician, going to some checkups and tests and scans and whatever you need to do, and then deal with the underlying condition that should result with tinnitus improvement. Before I jump to the summary, I just want to cover one more condition, which is sound sensitivity. Again, I think it depends on how severe your tinnitus is. Mine is severe tinnitus and severe hearing loss. So I definitely suffer from sound sensitivity. For me, personally, sound therapy of specific types is a lifesaver. And that is a point I didn't want to forget to mention that if you do have sound sensitivity, consider using sound therapy, which is increasing in volume gradually. Now remember a sound therapy rule for all kind of sound therapies. You should never listen to sound therapy which is loud. You do not want to make your tinnitus worse. I know it sounds funny, but some people are thinking that if they increase the volume of the sound therapy to the point where they don't hear tinnitus, it's a good thing, but it's not. You are just going to make your tinnitus worse or create other problems. So you really want to keep sound therapy to the point where you can hear tinnitus, but just barely, or just lower lower than the sound, the tinnitus volume basically. Just keep this in mind as a general rule, and if you do have sound sensitivity, just gradually increase the volume so to the point where you can tolerate it, and stop at the point where you can still barely hear tinnitus. That you don't want to go beyond that, okay? Remember that tinnitus can be affected and maybe even created by so many different things. It could be medication, it could be stress, it could be exposure to noise, it could be hearing loss, it could be diseases. Because it's so complex to diagnose exactly where it's coming from, just keep this in mind, and two general recommendations that other people say this all the time. I'm just going to repeat that, and I'm apologize in advance if it's kind of sound boring, but you need to manage your stress. If you're in a stressful situation, especially if it's ongoing for a while, you really need to manage your stress. And however you want to do it, whatever works for you to reduce your stress, really that's the bottom line. You really want to stay away from noise. And if you have severe tinnitus or even just the normal tinnitus, exposure to loud noise is just going to make it worse. So just stay away from it. And just a general healthy lifestyle. I know it sounds boring, but the more healthy you are and the more relaxed you are, the less bothersome tinnitus is going to be. It's just a fact. The second thing to consider is dietary considerations. So you may be actually allergic to something that doesn't make your stomach upset but create tinnitus. So if you notice that you all of a sudden your tinnitus become worse, so you have tinnitus, but then it becomes worse all of a sudden, try to think, wait, what was changed in the last few days? What did I eat or what did I do that is different than normal? That's typically how you can find out those weird causes for making tinnitus worse, basically. Again, guys, I really, really hope that this is helpful. We really mapped tinnitus types to the causes and then the treatment options based on the causes and the types. So I really hope that you guys found this video useful and helpful to you. Please, again, use the comments below to share your story, ask questions. Let's help each other. I mean, this is really a journey, and if we help each other, we feel better ourselves and we help other people. So comments below, guys, and I'll see you in the next video.